So for me, I feel like every medical provider should tell a gay man that post-exposure prophylaxis is available, and eventually pre-exposure prophylaxis is available. Give a card with it, like their after-hours number, so that people can get started on it. Because I think just a lot of people don't know, and you kind of miss an opportunity to prevent infection. For pre-exposure prophylaxis, Truvada is actually going to likely get an FDA indication for pre-exposure prophylaxis, which would be pretty incredible, because hopefully then the insurance companies will cover it. Truvada per month is about $1,200, so you know, if people would have to pay out of pocket, it would not be a reasonable option. But it looks like it's going to have an indication, so it will be covered. So that's as far as the medical intervention piece.
As far as my perspective, I really feel like, you know, I'm very glad to be able to be in the public health field and being able to do the community work that it takes to help reduce the vulnerability. I think we know, working with different government agencies and being able to work in those sectors where we have the data and we know where these HIV infections are more prevalent, so that we know that if our people are living in areas where there are more people with HIV, we know they're more likely probably to engage with sex with folks and end up with HIV. And those are the places where most of the times it seems like we're afraid to go. But those are the places that we really need to be going now to deliver those messages where those high rates of HIV and folks are living are in the city. And being able to not just put the heterosexual messages, but also the MSM, the transgender community, everyone who's affected by this disease, those areas need to be able to continue to have an outlet, continue to have venues that are going to cater to delivering these messages to those folks. And until we start you know, doing the groundwork, rolling up our sleeves and really going out there and pounding the pavement to let folks know. I mean, it's an equality issue as well. I look at it as a human rights issue because it is everyone's human right to be able to have viable health care and be able to know how to take care of themselves as a human being. That's one of the most common factors that we have. So I really believe that is a part of, from a community-based level, that is what I propose that we can do and continue to be the liaison and interface with these folks to help make a change.
I have one thing from the national level, and I'll say this is probably wrong. You know, the CDC gives all the health departments money to direct into their jurisdictions to do HIV prevention, surveillance, and what have you. But they also give them, not guidance, but instructions to say you have to prioritize this first, this second, this third. I think that they need more leeway to say, we want to do this, this, and this in our jurisdiction, as opposed to you telling us that we have to prioritize this first and this second, just because, you know, the suits in Washington felt like that's the way it ought to be. I think that that would help to engage people. I think that we need to rethink community planning and how it's done. I think that we need to bring people together who are not so well versed in this topic as we are. They may be doing something totally different with their lives, but they need to be engaged in this conversation, and I think that's important.
Well, I just wanted to say one quick thing, because I know we're about to wrap up, and just from my own, just a personal perspective, even though you have a small group here, this is a group of people who obviously are invested in this and who are obviously educated about this. One of the most important things that anybody can do in their community is make sure that we just talk about these things and that we reach out to other people. It doesn't mean we have to beat people over the head with it all the time. Because Chris was talking to us earlier about somebody that he called an everyday, somebody who is part of our community, but who isn't plugged into every issue the way a lot of us are, because either it's our professional work, it's our activist work, or it's something we just live and breathe every day. There's nothing wrong with being an everyday, there's nothing wrong with being an activist, but it's incumbent upon us who do have the information and have the desire to do it, to talk to people all the chances we get in a friendly way, in an encouraging way, in a way that models the behavior that we hope to see in our communities. So that's all I have to say.
And on that note, our next community conversation will be on April 30th at the DC Center, co-sponsored with SAGE and Whitman Project, and it's going to be talking about how we can improve the care for our elder community, or our aging community, or our older community. There's a new sort of language changes, so please come and attend that. It might be a slightly different conversation than the one we had tonight, but it should be interesting. I want to thank our moderator, Sean Rourke, and our panelists. And I'm really, really engaged, intent on how to figure out how we get more people into this discussion. I jokingly say we need to build an army of 10,000, but that might not be a bad thing. But anyway, again, thank you all for